welcome back. Today with us, I have Dr. Daniel Su, who is a urologic, such a tough one here, urologic oncology surgeon at Saddleback Medical Center. Welcome. Boy, that's a long title.
Thanks for having me here.
You're welcome, you're welcome. So today, we're gonna talk about prostate cancer and the treatment options. But before we do that, tell me a little bit about your background.
So my name is Daniel Su. I'm a trained urologist with a fellowship in urologic oncology. What that means is a subspecialization in urologic cancer, such as prostate cancer, bladder cancer, and kidney cancer.
Okay.
And I mostly work at Saddleback Hospital treating those disease entities.
Okay. And then how did you get involved in the prostate cancer aspect?
It's mostly due to my fellowship. My fellowship was at the NIH in Bethesda, Maryland. It was a very strong program for prostate cancer screening, detection. It was one of the places that a lot of the more recent prostate cancer screening tests originated from.
Okay.
So that's why.
So it was just exposure, and you thought it was a good source. All right, great. Let's talk a little bit about who is at risk for prostate cancer. Is there an age group?
So it's generally believed that most men in America are higher risk for prostate cancer versus other countries such as Asia. The general screening age starts around 50 years of age.
Okay.
However, there's some very well-known risk factors. The biggest three are age, so 50 or older, African ancestry, and any man with a first-degree relative that has prostate cancer.
Okay.
So for those patients, generally the screening age is around 45.
Oh, okay. So you get a head start just to make sure there's anything developing. All right.
Correct.
All right. And then warning signs for prostate cancer. What does someone need to look out for?
So that's one of the issues with prostate cancer, because most localized prostate cancer, cancers that has not spread, do not have any symptoms.
Wow.
So advanced prostate cancer, men can start developing urinary problems, such as going frequently at night, weak stream, maybe blood in the urine, maybe urinary tract infections. Very advanced prostate cancer can cause pain in the joint, pain in the back, but usually those cases are metastatic prostate cancer already.
Okay, so when a man is 45, how does he go about talking about screening? Is it something the doctor will bring up, or is it something that the patient needs to bring up?
So that's a really good question, because the recommendation has changed a lot in the past 5 to 8 years. Nowadays, we recommend something called shared decision making. So the act of screening itself is actually considered a very big decision to make. The reason for that is the tests we have available can potentially detect cancer very early. However, over-screening can cause a lot of side effects, unnecessary procedures, and complications.
Okay.
Generally speaking, it's a conversation between the patient and their primary care physician, or between the patient and their urologist. And the test, it's really two things. One is a blood test called a PSA, or prostate-specific antigen. The other one is a prostate exam, which is done annually.
Okay, okay. And that you should start doing at the age of 45?
So average age of 50, but risk factors such as family history, African ancestry at 45.
Oh, okay, okay. So the first one they would do was the PSA though, right?
Correct.
Okay, okay. And if that found something, then would you do the prostate cancer evaluation?
That's a good question. The exam itself is very innocuous, so it's probably recommended to do at the same time as the PSA, even though the power to detect cancer between the exam and the PSA is probably has more power, more accurate.
Okay, all right. So let's say you do have some sort of starting prostate cancer. What is the next steps after that?
That's an area that's very exciting in terms of cancer treatment, specifically because prostate cancer is one of the rare cancers that you can actually follow very carefully and not treat right away. It's something called active surveillance. In general, when prostate cancer is initially detected, if it's still localized within the prostate, there are three main treatment options. One is active surveillance, and the benefit of that particular treatment regimen is that you can defer or avoid a lot of the side effects associated with treatment. you can potentially be followed forever and that never needs to be treated. The second way to treat prostate cancer is robotic surgery to fully remove the prostate and potentially cure the cancer. And the last option is radiation therapy to the prostate.
Okay. Now, I've talked to a variety of doctors that are talking more and more about the robotic surgery. Is it the same kind as some of the others where you are actually doing this and then you have your hands in the thing? Okay.
Yeah,
wow.
it's very, I mean, we're probably on the 5th or the 6th version of the actual system.
Okay.
It's a very sophisticated system with 4 different robotic arms. The surgeon is actually sitting away from the patient, but right next to the patient. We have 3D vision, so there's depth perception. The robotic arms themselves they look like miniature hands. So you have 7 degrees of freedom of movement. You have very, very accurate dissection, and if you couple that with the 3D vision, you end up having a much safer and accurate surgery.
And also recovery is better too, right?
That's right, yeah. Nowadays, most of our patients will stay in the hospital for less than 24 hours.
Wow.
We almost never have to transfuse our patients with blood, and a third of our patients don't need any pain medication.
Right. Wow, that is just amazing. I mean, and technology just keeps getting better and better and better, so it's very helpful to you.
There are actually evidence showing that the robotic system actually prolongs surgeon lifespan.
Oh,
because
good.
we're sitting instead of standing, and we're not really hurting our backs or our neck.
Wow.
And in general, I think for prostate cancer, medical technology has really pushed and advanced quite a bit even in the past 5 years.
Okay.
There's a lot of interest, a lot of research funding into the cancer itself.
Yes, exactly. And then at what point do you get involved with the patient? Is it once they've been diagnosed?
We, as urologists, we actually will see patients sometimes even before that. More and more, the shared decision-making part is being sort of funneled towards a urologist to have a very detailed and very sort of educated discussion with the patient about even getting screening or not.
Right.
So
okay.
that's about a third of our patients. Other are patients who are diagnosed already.
Right. Okay. So now we've obviously talked about all the things you can do once you've been diagnosed with prostate cancer, but what can they do to help prevent it?
It's a great question. There's a lot of research that's going into it.
Okay.
Unfortunately, there are no concrete evidence. So majority of the research interest is focused on dietary and lifestyle changes. We know poor lifestyle habits can increase your risk for prostate cancer. Things like lack of exercise, eating a diet that's high in animal fat or high in protein. We don't have any direct link between specific nutrition to prostate cancer prevention, but in general, what most urologists will agree on is that if you exercise every day, if you eat a diet that's rich in vegetables and fruits and low in animal fat, that should lower your risk for prostate cancer.
Okay.
But there's more research to be done there.
Right, right. Okay, well, good information. And then if somebody wants to know more information about this particular type of cancer, they can go to memorialcare.org and then /SB cancer, correct?
That's right.
Wonderful. Well, thank you so much for the information. Did I cover everything?
You got it.
Okay, good.
Thanks for having me.
I appreciate it. Thank you. So don't forget, it would seem that every time we do talk to a doctor, exercise is very key in all of these different types of ailments. We'll be right back after this.